Ah, the pig heart. What we're looking at is well, you can see that large interventricular coronary artery. The heart in its wisdom is going to feed itself first, so coming right off the aorta, the first blood vessel is the anterior, that means front. Interventricular means it's between the ventricles. Coronary artery is the artery that feeds the heart. Now, if you're careful, you can slice the heart so that the ventricles are noticeable. Now there's lots of here. Let me help you with the. There's lots of tissue here, but look at the muscle. Look at the muscle mass on this ventricle. So you know what chamber you're looking at. You can kind of ignore that probe. That probe's going all over the place. But this is the myocardium, and so with this much muscle mass, you know that you're looking at the major pumping structure of the heart, and that is the left ventricle. And so knowing that much, you can kind of assume that, all right, the aorta's coming out of here because we're going to pump blood from the ventricle here through the aorta into the body. Now, if you look at this tissue here called the Chordae Tendineae, these are tendons that attach to papillary muscles right at the base. Yeah, we get a good close look up there. Papillary muscles help with the contraction of the Chordae Tendineae, which are going to pull this valve. This is the bicuspid atrioventricular valve. And so if that's a valve, and that's the left ventricle, then we know up here somewhere is the left atrium. And I know on the models, sometimes we study models and then we get a pig heart and it just looks like a mess. But here is the atrium. If you follow my pointer, forget about that probe for a minute, you'll see that the atrium's up here. The auricle or ear-like structure is sliced right there. Okay, now he's I'm gonna try to look in there. There's the atrium. If you notice these blood vessels here, well, okay. Oh yeah, let's look at the other chamber. Because if this is the left ventricle, then we must have a right ventricle somewhere, and there it is. Now, how do you know it's a right and not a left? Well, look at the wall. Here's the exterior wall right here, and you see how thin that muscle is compared to, look at the massive muscle on the left side, look at the small muscle on the right side. And so you know you're looking at a right ventricle, and so up here somewhere is going to be the right atrium. Let's skip ahead a little bit. I want to look at some of the blood vessels that are difficult. Okay, yeah, there's a good. All right. Oh, I like this. So there, I mentioned the aorta because it's coming right off of the left ventricle. There's the aortic semilunar valve. There's the aorta. And so what is that? Well, one way to track, and you'll find this with a pig dissection. Sometimes you have to put your finger. Yeah, nice. Oh, arteries are always very muscular and round. When you find a vein, you'll know it's a vein because it flattens, especially in death. Okay. Oh, so we're tracking. There's the ventricle. There's the aortic semilunar. And there is the aorta. No questions there. So this is not really a mysterious blood vessel, but I'm still wondering about this one. I'd like to know. Oh, okay. We're just looking at the semilunar. Let's get back to this. I'm not sure what's going on there. All right. Here we go. Just be patient. Working with pig heart, you always have to be patient. Here we go. Okay, what is that? Well, I usually stick my finger in there. We can use a probe too. Problem with the probe is sometimes you perforate the walls and then you make your own hole, and then you don't know where you are. But take a look at this. Going into the right ventricle. So if that's the right ventricle, then we know that that is the pulmonary artery because it goes excuse me, right ventricle. Yeah, pulmonary artery going to the lungs. Okay, very good. Thanks for watching.